Yes,
And
Can. Yes, I
mm,
can.
okay, great. And are you guys seeing my presentation?
perfect. Yes.
All right, awesome. I'm glad. Okay, well, it's a to start. My name is Arsalan. I am a senior director of pharmacy at Central City Concern, and it's really a privilege here today to represent work that I've done by my amazing team who goes above and beyond to make this a low barrier program. And a serving a population that's often mistreated and misunderstood. So it's especially an honor to showcase the work of the team that provides such a compassionate care with so much empathy and uh, get care and so much for the people. So I have short time today. I'm going to try to be quick. Uh, the intention today is to highlight some of the services that we do and like the low barrier nature of our program to inspire other clinicians and inspire other health centers to kind of being able to implement that. It's less on the data side, but if you are like me and love data, yeah, feel free to email me and I'll be happy to share the effectiveness of it. So with that, let's go ahead and get started. All right. These are my disclosures. All right, so we'll start with our web of connectivity. For those of you who do not know Central City Concern, we're in the Metro Portland area. One thing that Central City Concern has in just general, we have housing services, we have primary care services, and we provide job type of aid to people that are experiencing houselessness or are at risk of being houselessness. We have two primary care centers that are integrated centers where we provide MOUD services or MAT services or SUS services, whatever you want to call them, and then along with primary care services, and there's other housing support and everything. So those are our big centers right here. Well, something that we really do well that is we have a lot of opt-out related services. So anybody that comes in through our services, they kind of get screened for hepatitis C, HIV, some of the other services. We have internally detox centers. So we have our Hep C services kind of built into detox services where everybody that comes in will get service or get screened there. We have RCP type of services to the bottom right. We have culture specific outpatient mental health and such type of services. Again, we work with them as well, and we've kind of implemented all of our screenings in those. So everybody that kind of comes in will get screened there. To the top left is some of our supporting housing services. So that's more of our, it's anywhere from somebody's with us for a few days to permanently. And anytime that anybody comes in our system, our housing services use Apricot, which is, housing world of EMR. I don't know what they do with that system, but we were able to implement a Hep C questionnaire in there. So actually housing non-healthcare professional folks are asking is like, hey, have you ever been tested for Hep C and things like that? And then if they answer yes, then we get that information automatically. I will not tell you how long it took to get that one question in, but we were able to get that in within that. So that's been really helpful. And then bottom left is our just connectivity in our community. So being out on the streets, being in the shelters, being food services, and one of our biggest partnership with the opioid treatment centers like CODA and Allied or CTC or Arcadia, however you know them. And that has been a really, really impactful uh, um, partnership in treating this population. Just quickly, I know I said I want a lot of data, so just quickly, over the last 5 years since 2017, we've treated over, we've tested over 10,000 patients, and I'm gonna go to the next slide real quick. We've had over 2,200 people that have been RNA positive, and we've been able to start treatment, or what we call linkage to care on 85% of them. We feel pretty proud of having the such a team dynamics and services that we're able to start so many people on there. And our linkage to care rate's really, really high. And our patient finishing treatment, what we identify is either their last appointment, if they're on a 3-month treatment or a 2-month treatment or the second appointment, that's and it's been over 90%. For the last, up until a year ago, we've been focusing mainly within our own health system, so within CCC. So our linkage to care rates have been really, really high. Now we've kind of expanded beyond over the last year to just our services to OTPs, and now we're at the coast and we have different OTPs throughout Oregon. So that linkage to care rate is a little bit lower than it was, but it's such a new program. We've only been doing that for about a year. So now we're implementing telehealth and learning from the team at OHSU and different partners to how do we then increase that. So we're kind of excited about kind of getting out our health system, impacting more of a community and then the entire state. Okay. So I want to talk about some of the lowering barriers interventions or services that we have that I think that will be really, really helpful. Our program is very, very complex. So I've kind of picked some things that I thought was really, really helpful given the time, but I'd be happy to, again, have a conversation if anybody has more questions afterwards. So the reflex bundles, DBS test, and the test and treat, I'll kind of talk about it in just a minute. But a few other things are like walking appointments and remote visits. We definitely try to make appointments, but we work on our patients' time so they can walk in whenever. As you all can imagine, the patients that we work with have so many other life priorities that we have to be very, very cognizant of that. So whenever they're ready, we tend to be ready. Remote visits, I know technically we kind of think of televisits and things like that, but remote visits are also our pharmacists literally going out on the street sometimes, or going to the detox centers, or going to the patients like wherever they are. And many times our visits are happening there. So when we say remote visits, it's not just telehealth visits, it's like our pharmacists literally being out in community. Navigation and outreach support. One of the thing that I have noticed that our team which will meet in a second at the end, not only does patient navigation, so insurance navigation and just communication and liaison, but just building that trust, because there's such a mistrust in the system and healthcare. They're often mistreated, and taking them through the process of like, hey, I understand you need a driving license. What can I help you with kind of doing that? Because that's on the top of your mind today. Okay, so how can we get some of those things ticked off so you can actually then care about your Hep C, and then we can kind of do that. So building relationships have been really, really impactful. We have purposely tried to hire people with lived or living experiences. So, and they're part of our team because not only they bring such a diverse point of view, they're able to connect with the patients and speak in a language that I have seen that other people can't. So that's been really, really important for us. And then strategic partnerships. As I mentioned, we have a lot of strategic partnerships internally within our health system. So with our housing partners, with detox, and then within the community. So like with shelters and with OTPs. And when I say those partnership, it kind of goes beyond just like, hey, let's do this, to like, what are the legal contracts that we need? So when somebody says that, hey, I'm positive or I need this, you can automatically share that information to me, and it will come to the right people in a manner that they can take in action items. So it takes the whole logistics end of it and just kind of bringing those partners along. Everybody in the country, but in Oregon, healthcare specifically, is burnt out, is overworked. So trying to figure out how can we put least amount of pressure on those people to ask them to do one more thing, and rely on the systems where it's just a smooth process, and then simultaneously educate even non-healthcare people about Hep C and the importance of doing work. So kind of taking two phased approach of like, why should you care? Why is Hep C important? And also, how can I make it easy for you? Right. So three things I want to go back to, like the lab bundles, the DBS test, and test and treat model. Quickly, something that we have when we do phlebotomy, we have all the lab bundles. So all the tests that happen, they happen all at once. And they're reflex. So if somebody's antibody positive, then we'll do all the other tests. If they're not, that's okay. We don't need anything, but we have all the sample size that we need. A lot of times what we notice is that each time you add a point of contact, we've seen up to 40–50% of no-show rate. So the more contacts you add, the less likely you're able to connect with those patients. DBS testing, for those of you who do not know, it's a test, a finger stick test that you can collect and get bunch of the testing, basically what you need to start somebody. And that has been a game changer for us. So we've been able to expand to not just beyond our system, to different parts of Oregon because of this test at OTPs and things like that. And that has been really, really helpful. And it has just increased our screening. Just last year, because of this, we were able to do over 5,000 screenings, which in the past we would be able to do like less than 1,000 or 1,500. This DBS test and treat and D-check model, and I'm sure that Hunter will probably be smiling there because he's a big part of developing this tool. This D-check model is a questionnaire that allows us to rule out decompensated cirrhosis with pretty high confidence. It's pre-publication. They're still working on that, but that's something that we are putting in our practice. And what really allows us to do is via DBS testing, we get all the samples that we need along with this questionnaire. So by the time we see the patient again, for simplified patients, we're able to start their treatment. It's so important and vital for our population because they can tend to, it's sometimes hard to find them. So when we have them, it's really, really nice to be able to just act on it quickly. And then this is my last slide, and I'll end on this because this is the most important slide. Before I kind of introduce these amazing people behind the scenes, I want to give a shout out to Dr. Andy Seaman, who's our Hep C director. Obviously, he's a popular figure, and he's one of the pioneers of Hep C and done some amazing work. And then Mark Rizzo, who's our clinical pharmacy supervisor who oversees this team. They do a lot of work on there. We have 3 prescribing providers that see the patients and do a lot of reviews. And then we have 4 pharmacists that do so much work, and their work is so impactful, and they're out on the streets working with this team. And then on the screen, you see Olivia and Lindsay. They're our 2 coordinators that kind of sit on each of the clinics, and they do a lot of navigation in terms of insurance. They're liaison between the patients and the providers, patients and the pharmacists. And then you see Emily, Sanjay, and Megan, and we don't have a 4th person yet. We're in process of hiring, and there are outreach workers, and they make those relationships. So if you think about a spectrum of treating from time somebody is screened to time SVR 12, the provider, even though it's an impactful time, is such a small window that they see the patients and start the people. But I would say 70–80% of the time people spend with these amazing folks, and sometimes that time can be a year of just connecting with them, getting ready to them about the treatment, giving the resources, just calling to say hello, and just over time building. And there's so many times where we've been trying to connect somebody for like 8 months, and all of a sudden it's like, you know what, Megan, today is the day, let's do this. And they won't answer our provider's phone, but they'll answer like Megan's phone or text, and they'll refer their partners or friends or community to them so then they can get started. So I would say big shout out to them. Relationships are definitely a core part of elimination, and the right people on the street or on the field. With that, I'm gonna say thank you so much for allowing me to share our program, and please reach out to me if you have any questions or if there's anything I can do to help.
Thank you, Arsalan, for that amazing presentation. I can't tell you how many kudos and love, and how much love is coming out of the chat for you all. Folks want to bring their mentees over to CCC to y'all and have you treat them, etc. So just know that your program and what you all have done, what you, Dr. Seaman, have done, what your entire team has done, has really revolutionized what can be done here in Oregon around viral hepatitis. You've shown us how to, and that's part of what we'll be rolling out hopefully with our elimination strategy.
Absolutely. Gratitude to everyone. And again, thanks so much for letting me represent the team.